Welcome, everyone. Today I have the pleasure of speaking with a TMS therapist, or more precisely an intern, Andrew Miller. He is an intern marriage and family therapist practicing in the LA area and incorporating psychodynamic, CBT, mindfulness, and psychodramatic techniques into his approach. In addition to being a therapist, he has also recovered from chronic pain using a TMS approach, which I'm sure will make this dialogue much more interesting. And in fact, that's what I'd like to start with. Welcome, Andrew.
Hi, guys. Thank you, Forrest. Thanks for having me.
And I thought that perhaps we could start just by telling going over your story. How did it begin?
I think, the sharing of our personal stories can be very healing in this process, simply because knowing that we're not alone is so incredibly important. TMS can be a very lonely disorder, especially when there's so many people in our normal surroundings that don't really understand what's going on, or we're not fully understanding as of yet what's going on. So it'd be really helpful to have that information. My TMS journey started, I want to say, 9 years ago. During that time, I was working in the film industry. I live in LA, as many TMS therapists happen to do. I had played sports in college. I had a lot of physical injuries that continuously showed up. Developed carpal tunnel, frozen shoulder, back problems, leg problems, very much on that physical spectrum. You name it, I had it. Saw doctors for years, doing many, many, many different modalities of, you name it. And much of it was conservative modalities. I was really trying to stay away from having any surgeries. Some people may recognize rolfing or, acupuncture, all these things. And everything was helpful to an extent, and then, would help a little bit, and then kind of, I would fall back, into the pain patterns. And I remember...
If I can interrupt for a second, did you
Sure.
have a sense that something more was going on, that there might be something that was connecting all of these? Or at that point were you saying, oh, okay, no, I just happen to have carpal tunnel, I just happen to have back problems. That, by the way, is an awesome mug. We went over it before that started, but it was a gift that
Yes.
I got.
Yes.
Happen to have carpal tunnel, or did you see some sort of connection in there early
on? I didn't at all, and I think that was so interesting and such a huge part of the TMS. I was not a emotionally minded person. There's something that we call alexithymia in the industry, and that's when people can't really recognize their own emotions. And that was certainly I was somewhere in that vein. What was really interesting was I was seeing a new doctor, kind of doing the rounds again, trying to get some help with these physical ailments. And I had horrible sleep, in pain at night, wearing braces all over my body, and got online, started looking around again. And there was a Harvard had an RSI wiki that I found. You may be familiar with this, Forrest. And I started going through all the different things that you go through intervention-wise. And someone wrote this little note that said, I've never tried this personally, but a friend of mine got this book called Healing Back Pain, and her repetitive stress injury went away. I was desperate at the time. So I look it up, and I look at it, and I see Dr. Sarno's website, and I start reading about it. And I can remember this very vividly. I was at work at the time, very infirmed. I couldn't type more than 15 minutes without taking a break, because of the pain in the arms of the carpal tunnel. And reading about the fact that there was something as called psychosomatic or TMS, and I said this to myself. I said, maybe this is what's going on. And 50% of my pain left my body in that moment.
Wow.
As a matter of fact, I actually got this really huge rush into my head, and I got very dizzy. And I think we don't obviously know the physiology perfectly yet, but I think maybe what had happened was very quickly the autonomic nervous system shuttered or turned on or off or whatever. And I think a lot of that blood flow got going that wasn't going. And I think I got a head rush. I think I got dizzy because of it.
Because it let go. Okay. Yeah.
Yeah. Yeah. And I called up the bookstore. I called up Barnes and Noble immediately. And I worked in film, and I was used to like procuring books for film treatments and things like that. And I said, yeah, I'm looking for this book. And they go, oh, I didn't even you didn't even have to look for it. He goes, oh, no, we have that book. Yeah. And I'm like, wow, went, got it. Long story short is I saw Dr. Schechter here in Los Angeles and I've developed a long relationship with him since then. He's a very good doctor. And he did the tests. Matter of fact, when he did a test for me when I came in, I took my shirt off for the physical, and I had a rash that I'd never had before across my chest.
Right. Okay. Yeah.
I think something along the lines of you may be the poster child for TMS is
Right.
something along the lines of what he said.
Because I have a bit of a rash now, right there. So
yes,
we'll talk about that later.
Absolutely, and that's certainly one of the things that have shown up. I've had kind of myriads of things over time. The symptom imperative is a devious thing. But so I said, what do I do? And he said, you see a therapist. And I said, I was not psychologically minded at all, but I went, and it just opened the door to so much for me. Namely that I had things that I wasn't paying attention to in my life, such as that I wasn't fully happy in my position, and that I did see my life going in a different direction career-wise. And that led to ultimately a decision to help people in the way that I was helped, because TMS, and I know people hear this all the time, and I think sometimes it's really hard to look at it this way. Especially when they're in the middle of a pain cycle or in the middle of some symptoms that are really trying. And all symptoms can be terribly trying. It's why they're so good as a defense. It's why they're so good at what they do. But it was a gift because it opened up a world to me that wasn't just a world of TMS medicine. It was a world of, I have an emotional world that I didn't realize. I have relationships now that I didn't have. And I relate to myself as a person, and that in a very different way than I did before, in knowing my perfectionist and knowing the part of me that's hard on myself, and that's a gift. And sometimes it's hard to look at a gift, but that was certainly a gift to me.
Yeah. No, I the difficulty in seeing it in gift, and also the fact that it is that some components are very much a gift. I can totally relate to. It opens your eyes.
Yeah. And that began the process of starting to become a therapist. In that time, I had a remission for a very long time. One of the things in the process was, I think a lot of people could probably relate to this. When I began to do the work, symptom imperative was off the charts, and stomach issues, IBS, headaches. I mean, all these different things were showing up. It was quite maddening at times, but having a good support system in place, I had a very good therapist, and having someone like Dr. Schechter, and then, that really, and also at that time I was a member of the TMS Help website, and, having that support system in place really helped me keep my confidence going, and gave me the wherewithal to keep pursuing, an investigation of my inner dynamics, which was really, really helpful. And then since then, on and off, I've had, a number of big issues show up in my life that have brought about TMS symptoms again. As a matter of fact, Forrest and I were talking about this before, but I'm in transition into private practice. I'm just about licensed myself as a therapist. I'm moving away from a treatment model. I've been in treatment for about 4 years, working in treatment with addictions, but actually a lot of people with addictions who also co-occurringly have TMS and psychosomatic issues. And in moving into the private practice, all those issues of perfectionism, of good enough. The pressure that I put on myself are bringing to bear. Some symptoms are showing up. So, I take it in stride these days as much as I can.
As a graduate student, an instructor, a college instructor myself, I can absolutely relate to that. I'm sure that it'll show up anywhere, but I can totally relate to that.
Yeah, and just that there are times where I think we can giving ourselves that grace to work on the issues, but then also times where it's just like, okay, this is what it is, and I'll have time to work on it here, but I may just kind of keep motoring on. Forrest and I were talking, like kind of how we have our TMS is why we have our TMS. A lot of how we deal with our TMS can give us added information about the way we deal with other things in our lives. I know that Sarno has said in his books that, don't focus on the symptoms. And I think that that's very important in a lot of ways. But I think working with a professional, sometimes we can focus on the symptoms and say, okay, how are you dealing with the symptoms? Do you have this crushing desire to eradicate them? And wow, how much pressure that might bring to the table. And it's a tough one because I don't know anyone that pain is an incredible motivator. Distress is an incredible motivator, and in my experience with TMS clients and PPD clients is that they're very motivated to get better, and sometimes it can just the gears can start grinding. We just want to be really mindful and aware of that.
That is so true. I was talking to someone just earlier today, and it's interesting how you talk about it's almost like another form of transference, right? Where very interesting information comes out in your relationship with a therapist. Very interesting information comes out in your relationship with the TMS or the PPD. And you can learn about everything that's going on by the way that you relate. That's an interesting model. And yeah, we all put so much pressure on ourselves to get better.
Absolutely, absolutely. I'll give you a freebie for us. I'll give you the listeners a freebie. One of the things that Forrest had mentioned was I do a number of different modalities in working with TMS, and one of them is psychodrama. And a lot of psychodrama individually has to do with letter writing. Those that are familiar with Dr. Schubner's program will be familiar with that. And I think Dr. Schechter's done some of that work. And I've often had clients write a letter to their TMS. As part of the process. And I know it sounds kind of, a little odd, but if TMS was an entity, was a person, what would you say to it? How would you relate to it? And that I have no guarantee that there's a correlation one-to-one. You do that and your pain gets less. But what often happens is people develop a greater awareness of, wow, this is how much, my perfectionism's coming into this. This is how much, I actually want my TMS to be around a little bit. Maybe it's doing something for me. I know Sarno talks a little bit about secondary gain, and I think it can and cannot show up and stuff. But I would say that, I hope one of the takeaways that the listeners and the watchers can take from this is awareness is a huge part of the puzzle of living with and getting rid of TMS. Just becoming more aware of how it is we do what we do, how it is we relate to our internal dynamics, how it is that we relate to our life pressures, how it is that we relate to the still held trauma of our youth. Because it's just
is that related at all to mindfulness? I know you mentioned that as one of the modalities that you use.
Absolutely. I would suggest that anyone who suffers from psychosomatic illness really look into some sort of mindfulness practice. Mindfulness, in what I focus on with my clients, mostly is twofold. One, it's becoming aware of the symptoms, where they are, what they're doing, trying to do it somewhat non-judgmentally. The other is bringing just a very concentrated attention to one's own sense of awareness of what's going on in the moment. So what is the sound of traffic, or what is, to get out of maybe the underlying schemas that are kind of running. We may be having active thoughts of I'm not good enough, or this person's pissing me off, but we may be even having thoughts that we're not fully aware of, oh man, I just will never get this project done. And become so completely unaware of it. Oh, I'm not good enough because I'm procrastinating. Absolutely. And so developing some mindfulness, and okay, so I'm going to take myself out of that schema, out of that pattern of thought, whether I know I'm in it or not, and just draw my attention to the present moment, where I'm no longer attached to that identity anymore. Additionally, I find that in doing a mindfulness practice, many of the clients I've worked with mindfulness, while it may not, again, have this one-to-one correlation of, getting rid of their TMS symptoms or this or that, it takes the edge off of, oh, I cannot tolerate having this symptom right now. I know what the underlying schema is. I know my dad was, abusive to me. And why can't I get rid of my TMS? What I find is with mindfulness, it calms that frustration. It calms all that stuff down. Not that it goes away, but that we're more able to look at it. We're more able to take that with us and go forward.
So that actually brings something up. I see that a lot on the TMS Wikis forum. I see that it's a stage that a lot of people go through where they say, okay, I'm mindful. I'm meditating every day. I'm doing the journaling. I figured some things out with the journaling. What do you say to someone who's in that position, who's got something, they've made insight, they've done the journaling, they've maybe used Dr. Schechter's workbook, or they used the Wiki's structured educational program? What do they do next? What's the kind of the day-to-day thing that they can use if they've got some insights and pain hasn't resolved just yet?
It's very interesting. I think in some ways it is a case-by-case basis, but at that point in time, I think wanting to know what that all means to them. When I have a client who is doing a lot of the work that we prescribe to them through the books and through many of these other things, and they're doing the work, they're still having some issues, they're making progress, or maybe they're stalled. What I really want to know is, well, what does that mean to you? What does being stalled with your TMS mean to you? What does it mean to you that you're doing this work and you are or are not getting the expectation that you want? Usually what I find is in delving into what it means, we may find hidden stuck points, hidden points of being stuck, hidden points of the schemas showing up again, of the perfectionism, the goodism, issues of acceptance and tolerance, and I find that can really be very rich and fertile ground to go through. And then again accepting that the timelines are a huge part working with psychosomatic clients. When will it be over? When will it be over? When will I have a 50% reduction? Will I have reduction? Or, why is the timeline not like going down like this? Why is it up and down and up and down? And just dealing with some of those frustrations and maybe building a space for a little bit more acceptance. That idea of going about and doing the things that you would do regardless of the TMS symptoms is a way to show them that they don't need to be around anymore. Well, also to just, live our life as best as we can, and seeing how just the focus on that can become a distraction in and of itself.
So you're not just sending a message. You're not just sending a message to your unconscious that, hey, I'm healthy. You're also just doing it because you enjoy it. And by doing it because you enjoy it, by immersing yourself in your life, that sends the strongest message to your unconscious.
Yeah. And how we can get wrapped up, again, with that. I've heard many other practitioners talk about this, how we can get wrapped up with the dealing with TMS as its own distraction. And just to be aware and mindful of that, of the journaling and all those things can become in and of themselves, that take up so much time and so much. You'll see, I've talked to a number of people in the field who say, well, really don't do more than 20 minutes a day of journaling. Really don't do 15 or 10, and take a day off. I tell clients that who are just on this hell-bent thing of journaling every day for 30 days, and I see someone, and sometimes something, maybe it will be intuitive and about the amount of pressure that's showing up in the room, and I'll say, take this weekend off, or take this weekend off, and even if the symptoms are there, maybe use a different coping mechanism to kind of help you accept the symptoms right now, but take a weekend off.
I love that, because you get these people who are they're just journaling so furiously, and as you said, chronic pain is a very powerful motivator. So of course they're going to journal intensely, but you just know that isn't helping them somehow. That's the TMS itself. That's motivating. That's the new distraction for them. And I love the way that you put it, because just to relax and enjoy life.
And
a little bit of acceptance.
A little bit of acceptance. I found that for many clients that I've talked to, and this goes across just TMS and psychosomatic. I mean, people have been doing work with acceptance and these issues in psychotherapy, for way before I was ever on this earth. But if we can look at it as a gift, if we can look at it as what is this revealing to me, showing me, how is it, maybe allowing me to show up for other people in different ways. If I have pain, maybe I understand something of someone else who has difficulties. And that looking at it as a gift has its own rewards. I've also worked with some clients that have really gained a lot of perspective and a lot of, and I know this is counterintuitive, and I know people are going to be like, well, I'm going to do that. But, just like, well, come whatever may, I'm just going to accept whatever's going on. I'm going to accept my symptoms, and just really just being like okay with them. Interestingly enough, there tends to be, a gradual lessening of symptoms that way. And the minute that we're like, ooh, gradual lessening of symptoms, I'm going to be more accepting of my symptoms, then the pressure builds up again. And, so sometimes it can just be, boy, it's just it's a merry-go-round. And so I love the work. I love the insight-oriented work. I love the journaling and stuff. But sometimes we also have to unplug from the merry-go-round. Yep. And actually that there are other techniques to unplug that may not even deal with the TMS, but it may be mindfulness. It may be distraction. Sometimes it's just, unplugging is I'm going to watch TV and eat some Ben and Jerry's.
Right.
And it's just, and for a lot of people, it's figuring out how that is, going forward.
That's what I love about talking to people who've been there. And I love that phrase, unplugged. I think that's sometimes what we need to do is you need to unplug from the program. And what I think is difficult is because of the TMS perfectionism, because of the TMS personality, they want to unplug and make progress. I'm going to unplug because I'm going to achieve this goal. But no, you just unplug to unplug a little bit, and you just have to have patience, That's the way it goes.
Doing it, and I lost the track of my own thought when I've probably done that a couple times in talking to you guys. But in doing that, in plugging that piece of acceptance, well, I'm going to do. It's interesting. I've had some clients that to do journaling just for its own sake, to journal without necessarily a goal in mind, can be very helpful. However, I've had clients that have done that, and they're not like searching for this deep dark secret or something, and they're journaling for its own sake, and they actually find that that's more productive. They actually find that there may be a correlation between that and feeling better, their symptoms reducing. But again, they may get into that pattern very quickly of I must journal with no goal in mind, and then that becomes this goal as in and of itself. And so this is a very self-serving comment, but that's why it can be very helpful to work with a TMS professional, simply because there are areas of our awareness that we're not necessarily seeing in doing this work on our own, and doing the journaling without having that person to reflect back to us what they may be seeing, where we may be missing the dynamics, going forward.
Makes a lot of sense. Yeah, definitely. I mean, I think that is very helpful. Okay, so I think we've talked a lot about what has helped you. Various techniques has helped you overcome your own TMS. Are there any other techniques that you want to go over in terms of?
And many techniques that are in the therapeutic world are, very helpful across the spectrum of disorders, whether it be TMS or any addictions, anything. I know that some people in the field right now are really looking to intensive short-term dynamic psychotherapy. I know that that's kind of a big thing. I tend to use a certain amount of mindfulness, the psychodramatic techniques. I've run groups before, so in getting away from the letters, we've had clients who, and this has been in treatment centers and with other things besides psychosomatic symptoms, though what's interesting is I've done these psychodramatic groups and people will have reductions in somatic symptoms and psychosomatic symptoms and doing the groups, treating other things, but where clients are together, bringing a group of people together and going through and acting out scenes from their childhood, having them have different outcomes than what they were, having them say, and this again speaks to letter writing that many people do, having them say the words that they never had a chance to say at an earlier time in life. Those can be very impactful. The mindfulness can be very impactful. Somatic work, just becoming more and more aware of what's going on in our body. Visualizations can be very, very powerful. I think it was Scott Brady's got some stuff about visualizations in his book, I think. But for many clients, visualizing is a great adjunct, and it's a great way to talk to that little child maybe in us who, it's okay to have a temper tantrum. It's okay to, be anxious. It's okay to be scared and afraid. I know that there's a lot of stuff in the literature about you won't do this and shouting down the TMS. And while I think that can work for some clients, I don't know that that's the direction to go. I think, talking to that inner child and saying like, it's totally okay. You can have a temper tantrum. I know I've said to you that you can't have one. I've internalized the message that we can't have a temper tantrum, but I'm now saying it's okay. Or I'm saying to you that I'm not okay with it, but I'm working on it.
There you go. Okay, yeah.
And so that works very good. I'm sure that there are, and also that sometimes medication. I think that there's a thing where, we should never take medication, especially talking to some TMS clients with pain. It's like, oh, I got to get off my pain meds right away then, because I know what this is now. Well, again, TMS clients, psychosomatic clients are so hard charging a lot of the times. It's like, well, it can take time. And sometimes, unplugging from the TMS cycle is taking medication. It's like, you know what? I'm having back pain tonight, and I'm just going to take some medication for it. I'll journal tomorrow. I'll deal with it tomorrow. I'm going to give myself a break.
That makes a lot of sense. And as I think about Dr. Sarno, and he does have this aspect, which is very much, especially in the older Sarno, he talks a lot about yelling at your symptoms. But from talking to patients, I do get the sense that he's much more open to the inner child work these days. That there's a little bit of a shift, and even I think it's in Mind Body Prescription. He's talking about medication, and I can think of the vice president of the Wiki, Matthew. He talks about how Dr. Sarno would give him medicine if he wanted it, because sometimes that's what you need. I think that the key is that if you're going to take medicine, something like that, you just recognize that isn't facing the real cause. You're still thinking psychologically rather than physically. It's just that, you're cutting yourself a little bit of slack. And if you do the psychological work.
Absolutely. I think that leads to another thing that I've seen both in my life and working with some clients in this regard is One, it's very normal for people to go through crises in their lives. And in a crisis moment, sometimes, you just take the intervention that's available to you that's helpful in the moment. Something's going on, you're having a crisis, symptoms arise again. There's nothing that says that you can't, use old coping tools, medication, whatever it is, to get you through what you need to get through. And then you'll deal with, the symptoms or whatever. Is that, sometimes you're in such a space that you may not have time to think psychologically. You may not have time to give it some real analysis. And that's okay too. That's human. That's part of being human. And then also, speaking, I was going to go somewhere with that, but
Well, if I can jump in.
Yeah, please.
It reminds me a little bit of Dr. Fran Anderson. She was doing a supervision section teleconference for psychotherapists, and she talked about there's kind of this old psychoanalytic wisdom of, if there's a physical symptom, it's probably hiding, it's probably something protecting very deep, and you have to be very careful about digging it up, exposing it. And it's kind of the same thing. In some sense, there's having a little bit of respect for your defenses and allowing yourself to use those old defenses because they are defending you. They're there, as Dr. Sarno says, to protect you.
I've actually had people I've worked with talk to their TMS, and the TMS will speak back to them, well, this is what I'm helping you do right now. And that gives them some additional insight. This is what I'm protecting you from. This is what I'm, and boy, those can be really, really powerful, situations right there.
Interesting. So in our discussion group, Enjoy has been talking a lot about internal family systems therapy, and one of the things that they'll talk to a symptom, to a resistance, and they'll say, "What do you need?" And then another resistance. Okay, TMS, what do you need? It's interesting how all these ideas fit together.
Yeah, absolutely, absolutely.
One thing, as we were preparing for this, I thought was very, very interesting, and I was excited to hear more about, is you talked about how TMS is kind of a lifelong condition. And I think that's really important because you talked about the hard-charging TMS personality and how we want to solve everything 100%. And that kind of runs straight into this idea that it could be a lifelong condition. But that's my experience, is that it seems to be that. I'm just wondering if you could tell us a little bit about
that. Yeah, taking notes as we talk too about some things that are coming up to me. But I just wanted to touch. I'm going to rewind for a second, touch base. But one of the pieces that I really wanted to share this. And again, there may be things in this discussion that people want to take away. There may be things that they're like, that doesn't work for me. And I really am a big believer in take what you want and leave the rest. But I'm also a big believer in, I know, there's talk in the literature that we don't have to change things in our lives to get better. And I do think that there's a lot of merit in that. But I also think that we shouldn't become beholden to the idea that we don't need to change things in our lives to get better. I find that change, if we're, in a situation that we have a modicum of control over, and in changing that situation, I'll just use, like a workplace situation that is, you're really having a really hard time, and we have the power to change that. Sometimes that can have some very interesting effects on symptoms. And I've heard stories of people like leaving jobs and the symptoms going away. I think developing flexibility as a TMS person, as a psychosomatic client, patient myself, is so important to keeping symptoms at bay. Can I be a more flexible person? And one of those is that there are going to be times where I don't really have the flexibility to change anything in my life, and I'm going to work on some acceptance, and that can be helpful with symptoms. And there are going to be times where it's like, wow, I have some control here. I have the ability, however hard it might be, to make some change. And in making that change, I can affect maybe some change on my symptoms, on what's going on. And, even if you make a change in your life that you feel like will be for the better, and it doesn't reduce your symptoms, you still kind of won. I mean, come on, it's made a change, hopefully for the better.
Yeah.
It's, if you get rid of your symptoms too, you're getting your cake and you're eating it too. It's kind of a great deal. But I did want to, speak to that piece of change, because, there is that kind of piece of, I just, need to change anything. I just got to delve into the right psychic, locker, and I'll find things. Well, sometimes change will be the catalyst for real movement in TMS symptoms. Go ahead.
Thank you. And even if it isn't, you were talking about alexithymia. I feel like I suffer from a touch of alexithymia. Alexithymia, of course, meaning A is no, lex meaning words, for thymia, for feelings. So you can't feel, you can't access your emotions. And I feel like some of us who have alexithymia, it's because we're putting so much pressure on ourselves. We're not listening to our own emotions. And when you talk about fixing things, and yes, it may help with the symptoms, or maybe it won't, but you're really not losing it. It made me say, well, that's just part of being compassionate. That's compassionate towards ourselves and learning how to listen to our feelings, develop more of that emotional intelligence, more of what we're feeling. It seems like really good medicine for the TMS soul.
Absolutely. I think compassion. Yeah, of course, I think that word compassion is so important for people with TMS. We talk about perfectionism. We talk about inferiority complexes, low self-esteem, goodism, and I want to throw compassion into that, kind of group, because compassion, or the lack of compassion, I find is such a key piece. How do we develop a more compassionate way of dealing with ourselves? And that tends to have, a profound effect for a lot of people. What would be the most compassionate way, even asking some of my clients, what would be the most compassionate way of looking at this situation right now? And for some people, that's a foreign, entity. You can look at it that way.
Yeah.
But I don't want to get away from what you were saying earlier about this being a lifelong process. I read Sarno literature. I was like, I got rid of my TMS symptoms. I'm like, I'm done. I'm good. I'm great. And the next thing I know, it would pop up here and there, little itty bitties, not bad. And then, I think 2 years went by, and I had I had a bout of insomnia. That's what showed up for me. And I never had insomnia before. Like I said, I've had every symptom under the book, you name it. I probably had it. We talked about the things, rashes and all this different stuff in the body. And then insomnia showed up for me, and boy, that was a real tough one. And particularly because when I was in pain, I could just kind of bowl through it sometimes. But, insomnia, boy, that's tough. And I had to take some medication for it for a while, because I just, there's only so many times I can go, you will not do this to me, and then wake up and have no sleep the next day. So you can take medications until I felt, I could, try, here and there, a little bit of, psychosomatic talk. But I think living life and knowing that symptoms can arise again really can talk about that relationship again to TMS. If TMS was a person or an entity, what's my relationship to them? How do I deal with my frustrations about it returning? What does that say? What does that mean to me? What does it mean to me that this can show up again? What does it mean to me that to do the work that I do and still have it arise at times? And really just being a little attentive to that. Being aware of that, being open to that, and I think that's really, really important. That mindfulness that I talked about earlier was a great resource that allowed for more compassion about symptoms, more attention about symptoms, more ability to be like, unplug, as opposed to just hammer this, today. And that can lead towards, just a little bit more open, a little bit less pressurized relationship, which in turn can affect the symptoms.
So is mindfulness, do you think that mindfulness and self-compassion are maybe connected? Like, are they Does,
Yeah, for many people, Buddhistic thought, the compassion is a huge portion of that. And there's some thought that when we are truly being mindful and we're not lost in the world of our thoughts, it's very hard not to take compassionate action. Often it's about other people. It's that if we're really truly being mindful of the sounds and what's going on in the moment, and we're not lost in the future or the past, we can be truly joyful and compassionate towards someone else. The other side of that coin is that we can probably be more compassionate and joyful to ourselves. If we're not in the schema of, I gotta get this right, whether that is the thought that's going through your head or whether it's the thought behind the thoughts going through your head, lurking somewhere down there. For a lot of people, mindfulness, and I don't want to sell it as a cure-all because it's not, but a lot of people, mindfulness can get them out of that cycle a little bit, or at least to be like, oh, there's that TMS again. Wonder what that's about.
yeah.
As opposed to, oh, that's that TMS again. Oh, I gotta attack it.
Right. Yeah. That's very interesting. So I was very interested. Did you get a chance to go through all on your notepad? Because I'm eager to hear what you had to say. You said you had jotted some things down?
No, I was just trying some things down that we talked about, just in terms of I covered just about everything. I think I would want to say that this work, for anyone that's doing it, is such brave work. You had talked about earlier how some of the therapists have said, or one of the therapists said, that the pain's there for a reason. The symptom is there for a reason. Whether it's pain, headaches, insomnia, and that to delve into some of the stuff that's coming up, it's not fun. It's a lot of times it's not pleasant a lot of times, and that's where the compassion can be so important. That people are being very brave to do this work. People should give themselves license to take the time they need to do this work, and that it is a journey. And that journey is it's like a heroic journey, but it has its ups and downs. And if it's like a heroic movie, there's maybe that part in the second act where everything looks lost, and then all of a sudden some like spaceship comes out and blows up the Death Star, and you're fine. But it's such hard work, and for people that are used to being so hard on themselves, maybe not speaking for everyone there. That it's easy to fall down the rabbit hole of being hard on ourselves for not doing the hard work hard enough. And that's just such an important piece to be mindful of, be aware of. If I can extend some compassion tonight, and someone can hear these words and think, I'm doing a good enough job at this. I'm going at the pace that I can go at. I'm a big believer in that. Our unconscious minds don't really let us go at a pace faster than we can go at.
Oh, they have their own clock, yeah.
Yeah. So just to be aware that for everyone out there, you're going at the pace that you can go at, and that sometimes that pace is going to be faster, and sometimes it's going to be slower, but you're going at the pace that you probably need to be going at.
Well, that is a wonderful. There's a wonderful message for us perhaps to end on. It seems like you have a very pragmatic and compassionate approach, and I appreciate that. I think that's a good message for people to hear. Thank you very much for joining me today.
Thank you.
If anyone wants more information about Andrew or his practice, you can visit his website at www.thingaboutchange, as well as visiting the TMS Wiki's practitioner directory, found at www.tmswiki.org. You can link through to his website there as well. I know for me, for my own personal recovery, it was hearing other people's stories that absolutely transformed my life. That's what led me to create the Peer Network. I wanted to give people a platform to share their stories. So I just wanted to thank you for sharing. It was a very enjoyable and enlightening conversation. So thank you very much.
Thank you, Forrest. I really appreciate it.
Have a nice day.
You too.